some level of experience. First of all, good morning, good afternoon, probably good evening for a few of you. These are not final. We are still, using this session today to gather additional information, comments, and also things that I have not been able to capture, not fully capture during these assessments. But let's start with few housekeeping. I don't even like housekeeping at home. Imagine on a webinar, but let's say this session, as Andrea mentioned, is recorded. I think it's okay for all of you, but if you have some issue, just let us know. Keep your microphone mute when you are not speaking. There will be a session in which you will be asked to speak and to integrate what we are discussing. Use your camera if possible, but we also understand if you can't, because you may have bandwidth issue in your countries. Please avoid multitasking. I know we're all busy doing 3,000 things, but please stay engaged. We really need your feedback, your support, your comments, and your brains. If you have any technical issue, please let us know. There is the chat box. Andrea is checking the chat box for both questions, but also for if there are any issue. And use during the conversation, before we start the reflection and discussion session, please use the chat box if you have questions at the end of the presentation, and Andrea will collect them and we'll start answering or discussing those questions, and then we'll go to a more open discussion. So anytime you have an idea, even just an idea, just put in the chat box and we will analyze and discuss further at the end. At the end, after the presentation, we'll have what I call reflection discussion section. We'll see how much time. Overall, we have 1 hour and a half. If we promise, if we finish earlier, we will release you earlier. But we have hopefully the opportunity to use all the time after the presentation. Raise your hand and if you have a question, and just to make sure we are able to answer all the questions. Respect the other. I don't think we need this, but respect other opinion. We don't, we just need to integrate and discuss together everybody idea. You all have amazing experience to share, and I have sincerely seen and I can witness through the interview and the discussion I had with each of you. There is no scheduled breaks. I just have a fun slide at the end just to relax a bit. It doesn't have to be super structured, but just, like to take few minutes to then refocus on and reorganize for the discussion. So I'll start with the presentation. So Andrea already mentioned, this is a baseline assessment. The objective was and is to evaluate the current state of the implementation of the nurturing care framework for children in humanitarian setting. What we have done until now, we are finalizing after this discussion the final report, a work plan, but until now we have done a desk review. We have analyzed 20 HRP, 2 flash appeal, 2 HNO, of which 1 is Myanmar, and the other is Syrian Arab Republic, that include all the Syrian response in Damascus, cross-border Turkey, northeast, and the whole of Syrian response. Then we have done and developed an online survey. We send it to all the health cluster coordinator in the field to assess the level of health cluster partner awareness of the nurturing care framework, coordination practices that include, of course, the nurturing care framework, capacity of health cluster to implement specific action of the nurturing care framework. I have to say that with few reminder. We have had, I think, an amazing response rate, 75%, 21 response on the online survey, which I consider a good success. I think there was interest, and I think this has highly contributed to have a great feedback on what is going on, what we are doing, what we are not doing, what we are doing well, what we are doing a bit less well. And then we have conducted semi-structured interview with the health cluster coordinator to assess the more in detail, a bit assess the implementation of the nurturing care framework, the intersectoral coordination, capacity building, community engagement, funding, monitoring and evaluation, and of course we discuss also the challenges, solution. We have some success stories and future direction. You'll see in the presentation, I'll emphasize a few slides on intersectoral coordination and community engagement, because I think they are key. Of course, there is a lot we need to do on capacity building, funding, monitoring, evaluation. We'll also discuss that, but more specific on these two issues, you'll see in the presentation. And I have had the pleasure to interview 20 health cluster coordinator, all of you very engaged. We did it in the course of maybe 2 to 3 weeks, intense, but I think I have had really, for me, it has been a pleasure not only to capture the experience, but really speaking with people very engaged in the activity, in the emergency, in the response that we are implementing in the field. And we're gonna move to the next one. This was a question in the online survey. What is your level of familiarity with the nurturing care approach or the nurturing care framework? I think the response is clear. We're not that familiar, but several of you are also familiar, have discussed already I'm sorry, at country level, with your colleague, with your partners. Now, I don't think we are where we should be. And I have noticed also, because I was frantically monitoring the online survey basically every day, like Andreas knows. And I think they know where, mainly at the beginning, I think when we start the conversation, I think there was a level of, like going back and thinking more once you receive the email, once we start the discussion, that I think gave a bit more level of familiarity that was not at the beginning. I think I didn't report in this presentation, but there were also questions about how many of you have attended the webinar, and of course we know there was not a major attendance. I think I myself too took the time to watch and listen to the 3 webinars on the nurturing care framework that I think took place the past fall and winter, I think September to November. There is a lot of material, there is a lot of information. So I also, during the interview, I advocate for you to go back and watch if you didn't do. They are in the website. Sorry. Now, this slide is about assessment of integration progress. I think all of you know that this, we call it the question 10, was the last question about assessing the integration progress of the nurturing care framework. And the question in the interview was the level of agreement, Richter scale, about in your country progress have been made in integrating the nurturing care for children in humanitarian setting framework into existing health response. Now, I don't think we are where we should be with 100% on all of you recognizing that we have made great progress. But I think we have a majority of people that agree or neither agree or disagree. We still have 7 of you, I don't want to say exact number, but we have still health cluster coordinator that disagree with the sentence, which means to me that there is a lot of progress we can do and we have to make to further integrate the nurturing care framework. Now, this slide will be taken again at the end to see what we can do to move from a mixed response to a stronger agreement on the integration of the nurturing care framework. But this is what you have told me, what you have answered to this question. So this is kind of a picture of where we are now. Now, there were questions about opportunities for the health cluster to integrate the components of the nurturing care framework for children in humanitarian setting. Now, we do have a lot of opportunity. We do a lot of work. You see the bigger words, of course, are the ones that have been mentioned more. We do a lot of work with WASH. We do a lot of work with nutrition, with child protection, food security at all levels. We do activity in school. We do, cholera in school. We do mobile clinics. We integrated team. We, of course, work with nutrition and WASH in nutritional center, in healthcare center. We do work also with education in school, although nurturing care framework is mainly with children below 3 years. We do outbreak response in which we integrate nurturing component. And so we do a lot of that. We'll see how we do it and how we can do it better. But there is a lot of, we taking a lot of opportunity to work in a more, I don't love the word holistic, but in a more comprehensive way to ensure that the care we provide to these kids and their care given is nurturing. Now, this is, I think, another very important slide. This is coming from the desk review exercise. So I have inferred this information from what it is in the humanitarian response plan, in HNO, flash appeals. And these are the 11 activities that actions, that are in the nurturing care framework. And this is you have the percentage of count of clusters that have implemented those activity. And we can see that, for instance, community and home-based services, 100% of you have this activity in the response plan. Antenatal and postnatal care, we do a lot of promotion and health, hygiene, and training at all levels. But we do immunization activity. We do support for responsive caregiving. Of course, we have more issue in baby-friendly and maternity care, in developing child-friendly space and services. We have more issue on development monitoring counseling, also because we do emergencies. So developmental monitoring is something that goes on a more longitudinal way. So it's very hard for us to do this activity. But when we say, do we do activity and action of the nurturing care framework, this slide answer is yes. In many cases, all the countries are doing. Now we'll see in other slide how we do it. Do we do specifically with the aim and the focus on this specific age group? Not all the time, but this is also a slide that tells us how many opportunities to have to better and more integrate the nurturing care framework in our action. And we see that we conduct all this action in our response in the field. We can go back to this slide once we have a conversation. I'll be happy to have your comment, and I hope I have captured well what is going on at country level. Now, I think to also increase and improve the implementation and also the integration of the nurturing care, we need clear mechanism in the field. Do we have enough multi-sectorial mechanism established at country level to support the nurturing care framework? The answer is me, I would say no. Majority of you said no. And also, are there child development focal point, nurturing care frame. We open up not only to nurturing care framework, a focal point or working group, we open a bit more on also early childhood development. The answer is pretty clear also here. There are few dedicated resources. Now, there are, for instance, remember, just there are working table on early child development or care in Colombia. There is some of early childhood development work is embedded in the protection cluster in some country. We have the intersectoral work and intersectoral cluster work with coordination mechanism and also working group. There are co-facilitators of some cluster, especially nutrition and health, that work has focal points and has, I say, many collaborative effort, but few dedicated resource and few dedicated, structure, I would say, multi-sectoral mechanisms through which we can improve the integration of the nurturing care framework. Now, what are our challenges? You see in front of us the word lack, that, and everything rotated around lack of coordination among sectors, lack of funding, lack of access, and a lot of lack of awareness, advocacy capacity will, of course, develop this further with your, future direction and possible solution. But we have a lot of challenges, not only lack, but also many of you refer that competing priorities, working in challenging contexts. We discuss with many of you, we're doing a lot of mobile clinic. How can we implement a nurturing care approach when we are one day here, one day there, and one day in another area, and we don't know if we can come back because of security reasons? So we have also very practical problems. We are working in challenging environments, so it's not only lack of funding or lack of security or coordination, but it's also working in very challenging contexts and with very limited resources that we see them not growing but reducing. So from here, we go also on the recommendation implement the nurturing care, and I think Sheila is with us. She developed and authored the nurturing care framework. There are recommendations in the nurturing care framework, and I check again in the response plan and through the interview how many of those recommendations are then implemented or considered during your activities. And you see there is in several a prevalence of no. The dark blue is the no, and the light blue is the yes. But you see that, for instance, sustained specific action that contribute to nurturing care for children relevant to setting and the phase of emergency, we do. The second one, we do establish safe place and learning space for young children. We build on contextually appropriate practice and integrate them into existing service and delivery platform. And we conduct rapid response assessment and needs for instance, pregnant women, young children, and caregivers. So we are somehow using and working with the recommendation of the nurturing care framework. Maybe sometimes we do not realize, but when we do a picture of what we do realize that many of these recommendations are taken into consideration already in what we do. Are we where we should be? Probably not, but we're not to zero. We have already reached a point that we can only improve, we can only do better and more. And to finish, we do a lot of, we do protect caregiver for mental health. Sincerely, I witness and we discuss a lot about mental health support, not only for the kids, but also for the mothers, and we provide psychosocial support So not enough, maybe not where we should be, but I think it is clear that we are following the recommendation of the nurturing care framework, and we do integrate in the activity that we are running and doing on a daily basis in our countries. I think here health, and we know, and we are doing this assessment with a special lens on health. We as health provider, we have a lot of opportunity. We know to routinely and non-routinely to interact with these children. We interact with their caregiver. We do, prenatal, postnatal immunization. We do nutrition. We do a lot of health activity with these children. Do we use all those opportunities to offer a more nurturing care to this population? The answer is not enough. I think we keep saying, I keep saying, sorry if I repeat, we do it, but we don't do enough. There are examples. We'll go through a few slides with example of activity that we are conducting. But when we have a child that we are vaccinating, for instance, in this age group, I have discussed with you in many cases, you also, when you have time, when you have the resources, you raise your head from your vaccination activity and you look at the mother who also is in need, and she may have, I don't know, mental health problems, and you are able, and when you are able to offer a service also to her, you know that this child will have better chance for a better development in his future. Once we only look at our medical act, we know that we are losing an opportunity to provide a nurturing care to this kid and the family, and we will impact somehow negatively their future development. So we take some opportunity. We do not take all the opportunity we have. And I think, yes, of course, other sectors also have opportunity, but I think sincerely we should have and take the lead because we have normally more opportunity to interact with these young kids and their family. Now, we have a success story to be a bit more released. We do a lot, guys, really, and thank you for sharing with me, and this would be the report. We do integrated community center. We establish center that provide a range of services, not only health, but legal aid, as I was saying, mental health, MHPSS. We do in emergency response, we deploy integrated medical team that also have other sector integrated, also in conflict affected area. We do some holistic child healthcare program. We combine health with education, nutrition, support to ensure more comprehensive health care. We do integrated health intervention. I can call them multi-sectoral, I don't know, intersectoral for sure, in which we involve nutrition protection, but also food security in the intervention. Early child, we work on policy, probably not enough, but we try to work on childcare policy management with our partners, local partners, but also we need to integrate more the work we do with the local authorities. We do a comprehensive healthcare effort. We do, in many cases, also integrate care for caregivers, and we offer multi-sectoral packages targeting this age group. We do, for instance, a few examples. In Syria, we do integrated medical team. In Niger, we do family aid program that include nutritional support and food distribution, also to the mother of malnourished children. In Somalia, we have a stabilization center for malnutrition where we also offer care for a caregiver. Now, there are many more examples. I just cut capture a few. There are a lot of success stories. I hope you can further contribute in our discussion. So as I said at the beginning, through our assessment, we want to understand more our implementation capacity, but specifically intersectoral coordination, capacity building, community engagement, funding issues, monitoring, evaluation, and all our challenges, and of course, what we want to do in the future. So I now go a bit more on focusing on the coordination effort, where we are, our current status of the intersectoral coordination. There are a lot of existing efforts. Are they structured enough? We have seen that maybe not, but there is a lot of coordination between health, nutrition, protection. It's really evident. Is it institutionalized? Partially. We do a lot of integrated community center. We have seen joint planning especially for malnutrition, but many other activities also. We do emergency response with health cluster partner, but we also coordinate with different and other sectors for early childhood needs. Protection, nutrition, and also food security and education when it's possible. And we do a lot of this, as I said, a lot of this is informal, based on the needs, based on what we find is not probably structured enough, and as I said, is not embedded in a nurturing care approach as such. We not to justify, but we do have a lot of challenges to work more intersectorially. We have limited resources. I have to say, the conversation, we are not like we cannot do, we don't have resources, we don't have resources. Resources was never the first, especially finance was never the first, challenge or the first issue, but it is among the issue. Limited resources in terms of funding the coordination mechanism. Many of our funding do not include coordination mechanism. There are budget constraints, lack of dedicated personnel for coordination, and there is a difficult to align the nurturing care framework with the other ongoing program. We will see after how maybe approaching the planning time for our humanitarian response plan, how maybe we can strategize from now on in including it a bit, at least the language in the planning for the response that we are doing for the next coming year. More on coordination, how to enhance intersectoral coordination. Of course, we don't have to start from scratch. We have existing mechanisms. We have the ICSC. I have had discussion with Kamal on how to integrate it better, but we need to strengthen formal frameworks, develop formal national framework. We don't have enough. It has been really a request from your side. Establish dedicated focal point. We have already said. More resource allocation, how to address budget constraints and secure integrated funding, because if we have silos funding, we have silos activities, and then encourage donors, agencies to support a more comprehensive and multi-sectoral mechanism. Capacity building, I had the slide, but I didn't present on capacity building. There was a question in the in the different interview and the online survey on have they been capacity building or training on the nurturing care framework or more widely, broadly on early childhood development in your country? The answer was not 100%. There have been few efforts, although very important, on training community health workers, on working with mother in nutritional center, but not really formal training for health staff, but not also for, let's say, our partners. Data management is another important issue. We need to improve data collection. We have had question about indicators. I think we struggle to collect the normal health indicator, number of children vaccinated, number of visits, prenatal, postnatal. We also have issue with this basic when we ask, do we have indicators more on the nurturing care framework or more intersectoral and integrated indicators? The answer was not. I think with Andrea, and we'll present at the end, there was a plan to develop an integrated indicator framework. We will work with Kamal that has already developed a set of indicators, not to start from scratch, but I think we need for accountability, but also to measure our implementation level. I think we would need to develop indicator and of course to work with these, to collect these indicators. Now, as I say, the second important, no less important, no more important than others, but something that I believe could be also a venue for further improving and implementing and also integrating the nurturing care framework in what we do is community engagement. So we do a lot of community engagement. We do community awareness program. We work with civil society organization. We have accountability mechanism. For instance, in many countries now, there is this, I don't know if I can call it green line that people from the community can call. Now, you know, telephone are available in many, many difficult and remote areas where they can call, address their issue, and there is a feedback mechanism, but of course we don't do enough planning with the community. We don't do enough, enough involvement with the community, tailoring our program to their needs. We do risk communication and community engagement. We'll see on the key issue. We should do it more. We should do it more, not on specific issue, but more in an integrated way. And then we do local leadership and education, but sporadically and probably not in a systematic way. What are the issues? We have a lack of systematic feedback mechanism. Yes, some green line, some meeting with the community, but far from be a systematic feedback mechanism. We speak about accountability, but we need mechanisms to do that. We know I'm not telling many new things. I mean, I'm sorry. We have a weak accountability, and there is a resistance to community feedback. We are all afraid to be monitored and to be somehow maybe a fear of being criticized. Limited engagement beyond specific disease focus intervention. So there is a cholera outbreak, but then what else? What other needs we can address? I say there is a poor risk communication and capacity in community engagement. We need a stronger integration of community health intervention. I say with primary healthcare services, because this is what we have mainly discussed, but it's not only on primary healthcare. We need to integrate community engagement more in what we do. And I think this is could be really a venue in which we have a chance to offer a more nurturing type of assistance to this population. How do we enhance community engagement? Just to reinforce, we need to establish to establish formal feedback mechanism, integrate community health intervention, enhance community awareness program. This is all coming from you guys. I didn't invent, so, and if I didn't capture well, please correct me. Involve the civil society in what we do. Expand the role of community health workers. All of you are training and working, WHO, UNICEF, Save the Children, many organizations are working and training community health workers. We need to expand their role. and to kind of institutionalize. This is the link between our health and the community. I see it has, has a joint, has a glue in between, us and the community. We need to do more. We need to improve our risk communication, as I say, not only on specific issues in which we can be effective, but we need to broaden it to a more integrated approach. And of course, we need to support local leadership efforts. All of you have asked training modules for community health workers and on nurturing care practice, how to move from the framework to the population. I think would be key to improve or to offer more training to our community health workers. On the risk communication, community engagement, create culturally appropriate health messages and also strategies, advocate for an integration of community health intervention and primary health care, as we have already said. And again, engaging the civil society and local leadership in planning. We have also venue that already exists. We have the localization agenda. I think we probably have venues. We need to kind of merge our effort to move from the level of implementation we have today to a better level of implementation or integration of the nurturing care framework in the future months. Overall, how do we enhance our intervention, integrating nurturing care framework? A more holistic health service. We need to offer a health service that includes nutrition, protection, food security, psychosocial support. We need to look at this child, not from a disease viewpoint, but from a broader, holistic, more comprehensive need to be able to offer them a nurturing care, which is the fundament for their future development, to strengthen their capacity to be a resourceful person, a resilient person in their future. Community engagement, we have already mentioned, engage local community through sensitization program and feedback mechanism and capacity building. We need to develop more training for healthcare workers, community volunteers, but also for our partners, because we have seen that the level of familiarity that we have seen in the earlier slide with the nurturing care framework is not ideal. So let's go on future direction. Again, this is going to be probably and hopefully the base for our conversation once I have finished with a few other slides. Where do we want to go and how do we move forward? We need to enhance coordination, strengthen intersectoral coordination, and do more integrated services. We need to develop, many of you, sincerely all of you, if I can say, ask to develop tools and capacity building for advocacy. One brief note, a pager, a slide deck with few slides to be able to communicate, to interact also with donors, but with other stakeholders. Although sincerely, I see the nurturing care framework for children in humanitarian setting quite an operational document. Many of you still consider it theoretical. There is a need to translate it in more action and to be able to implement more of this activity in the field. We need to increase the funding, resource mobilization. Probably with this tool, we can do a bit more advocacy for dedicated funding, which we had a specific question in the questionnaire. There is no probably one donor that provides funding for this for the nurturing care for this specific age group. And again, correct me if I'm wrong. Probably there are some examples that I didn't capture. We need to work on policy, on advocacy. We need to develop national framework and policy or further develop framework and policy to support the implementation of the nurturing care framework. This means to work with a partner, working with the community, and working with the authorities. And then we need to, of course, to consolidate the framework. And many of you have said that we are receiving too many papers, too many documents, and then it's difficult to prioritize when you have a lot of priority already in the field. So maybe an effort to, to integrate those framework in maybe one framework in which we include other to have a more, an easy approach in the field. And then, of course, I repeat, training for nurturing care framework for the partners, but not only. Now, how do we fill the gap? So we said that we'll have ideally a time frame from this September, just to divide in quarters, September this year until December 2025. We want to do more. We want to implement more. We want more integration. We want to see more of this action in our activity. We want to see more comprehensive and holistic response for this age group. I put here the result of slide 5, which was how much do we agree? I think how do we move from 50%, I would say, of people that agree, but also a 50% of people that disagree or cannot really position to a better integration, or to be more convinced that we are doing step forward, I think is basically develop capacity building, more move from a sectorial to a multi-sectorial intervention. I was saying, existing platform, the ICRC. There is a lot of on early childhood platform. Also, the localization agenda can be useful, not to reinvent, but to use, and also mainstreaming it in our ongoing program. Developing tools to support. So hopefully we'll have the resource to support you in developing these tools that you have requested. Material for advocating with donors and stakeholders. Also, few of you have taken the opportunity, especially after the webinar organized by the Global Health Cluster, to have meeting focus on the nurturing care framework at country level. And I think this could have been, and we have discussed with many of you that, oh yes, this we can do, it can be easily done, and probably we will do it soon. It will be, of course, helpful if we can share with them some PowerPoint, some slides, some tools to make it easier for the cluster coordinator to conduct this meeting. We need to put the children and the caregivers at the center of our intervention, as I say, in the strategic document. Although I have extrapolated many activity and action from the OINFER, many of activity and action from the humanitarian response plan and the response plan in general, but it is not specifically mentioned nurturing care framework, and rarely it is targeted to this age group that we know is so important and fundamental for the development of the children, but also to making them healthier adults. And then also in the course of these 15 months, we also need to develop a monitoring framework for accountability and reporting. This will be part of the final reports, and hopefully we'll have the possibility to implement this, and we will listen to other idea that you may have of activity that we can put in place to strengthen our capacity to implement the nurturing care approach. Now I have basically finished. I don't know, I took almost 50 minutes, my presentation. This is hopefully the fun fact, or anyway, just taking few minutes to relax. I put here a few I hope that you are still with us. I cannot monitor. I have my slide in front. Some of the quotes that were in your in the reports, in the questionnaires. I know who did what, who said what. I just would like to know if some of you recognize their quotes. Read them, they're very interesting. I think the first two, they're really, really, really key. I mean, there is an implicit integration of holistic child health within our program, although not formally recognized as part of the nurture and care framework. I think if I should summarize all what I have said, this is and is I know who said this, but this has been said by all of you. The second one also on the top, we are not targeting specifically children under 3 years, although we are doing all those activities. There is a clear knowledge that the specific term nurturing care framework is not widely recognized or used in our health program. So we do all this activity, but we don't call it, or we don't frame it in the as a nurturing care framework. We do work with protection, walks, vaccination, nutrition, in nutrition prevention. We do a lot of mental health activities led by all our partners. But again, they are not integrated in the nurturing care approach. So I leave a couple of minutes first to read and to also see if anyone recognize that is present here. Be happy to verify. But otherwise, I finish the presentation. I'll in a few seconds pass to Andrea to see if there is any questions or remarks in the chat box, and then maybe we can take a few minutes to look at them, starting from there, and then open the forum to the other question that you can ask by raising your hand. Andrea, up to you. What you?
Hello there. Thank you very much, Donatella, for taking us through that. We do have a couple of questions in the chat, and as well as an observation. So just to get us started, why don't I throw the first question to you, and this is in relation to the multi-sectoral mechanisms. You had a slide on that, and the question was they were interested in noting which countries said yes to having an early childhood development focal point in their cluster or their country program. So I don't know if you can speak to that one a little bit, Donatella.
Yeah, at the moment I cannot. I have it in the survey. So if the person is interested, I think I can share. And I mentioned I have some example of collaborative efforts. There was Colombia, for sure, then they say yes. There was other example on co-facilitators at cluster level for nutrition and health. Other intersectoral cluster coordination mechanism. I remember Colombia has one country at least that say yes, but if I can go back to these questions, I can in written I can check. And I don't know if I can mention the country, but at least I can mention what they wrote in terms of the specific mechanisms that are present in their country.
Okay, sure. Ilana, I know you've come in with an additional comment. Did you want to just open your mic and come in on this? Are you okay for me to put you on the spot?
Yeah, of course, sure. Hi,
okay.
Thank you, Donatella.
Hello.
This was so excellent. I can't express how excited we are about this assessment and the findings. I'm Ilana Benin. I'm with International Rescue Committee. We've been supporting and working alongside the health cluster and Linda and Andrea and team to undertake all this work in the webinar. So one of the things that we felt really clear when we did the webinar series is even though there are a lot of challenges to this, there are just also great examples of where we are doing this well. So despite the fact that there's probably a long uphill battle until this is systemized, and we have training for everybody, and everybody feels confident what the nurturing care framework is. I feel like there are a couple of key places where there's great work happening, and it is possible, and it is garnering terrific impact and results. We are seeing that with our programs at IRC consistently. So I think I'm just mostly interested in, like, where is the health cluster already doing this, and what are the environmental factors, like having a coordinator in place, or like having an intersectoral mechanism for bringing people together that allow for that success to bloom, I guess. So I don't know if others are interested in that, like particularly the coordinators here who are leading this work. And if yes, maybe there's more to pull upon that thread, and just break out that data a little bit more. Thanks.
Yeah. And just to say, Lana, thank you for all your effort. I spoke even with some of your colleagues at the country level. Not only if you're interested, I think the final report will have a bit more of that. The challenge of a PowerPoint presentation where you try to put everything was not super easy. But yes, I do agree, and I think I try to emphasize the positive part. Of course, we are not where we should be, but there are a lot of great examples, even small examples, not great. I mean, there are programs. I think it was in Niger. They even give field to family that have malnourished children, in the hope, and not only in the hope, to make sure that these children and their family will not come back, with the same issue and the same issue. What if this is not nurturing care framework, or is not? So there are huge, big programs, but they are also small. When I talk about the mobile clinics, many of them, we are doing hundreds of mobile clinics. How do we make sure that at least we offer, a child-safe space? We offer something in which people can sit and talk in a more secure way. There are a lot of examples. This is not huge program, It's just thinking a bit more on how to do it better, how to do it more integrated, how to offer, how many we're happy to say we can offer mental health and psychosocial support to mother. I was really like looking the child and having the time to raise my head and seeing the mother and how she needs help, not more than a child has much has this child. And when we have the possibility to offer it, or at least having a referral system, this is nurturing care also. So from big example, from big project, also funded, to idea and implementation experience that seems to be minor but are important. Also to make sure, when I say we need to do training also we need to share more about this experience. I think you're perfectly right. If we hopefully be able to develop more training, more capacity building, we need to share our experience. I mean, I don't want to speak with the health cluster coordinator, and I don't even want to be in their foot, but these are people that are super busy, and they are dealing with tremendous issue. They are doing a tremendous job, and they sometimes need tools that are pre-done and easy to implement, to make sure that they can add to what they are already doing without reinventing the wheel or taking months to plan for activities. So I stop here because
thank you.
But I think it's very important. Thank you, Elena.
All right, thanks a lot. We do have one more question which has a few subsections in there, and then an observation. But I wanted to know, and we've got the conversation started, if there's anyone who'd like to take the floor, share your reflections, or or ask a question, please do. Shafiq, I see your hand raised. Please go ahead. The floor is yours.
Thank you, Donatella. It's fantastic work, and really, I enjoyed my session with you last time when we were discussing a lot of things are happening. As you mentioned in the fun facts, we are doing a lot for cholera response, for malnutrition, for MHPSS, for immunization, and different areas of the health response. We are doing a lot. directly, indirectly supporting the child care and child development initiatives. But I think we need to do more in terms of intercluster coordination. This is an important area. As I mentioned, for MHPSS, for example, we have good collaboration with protection cluster. Even we have developed an operational response plan for multi-cluster response to MHPSS related interventions. In our context, for cross-border Syria crisis, we have very strong AAP mechanism also. I think this is another platform or existing mechanism which we can use. On RCC also, we have done a lot, especially during the COVID-19 response. So there's a lot of good practices in mechanisms available which we can utilize. So also one more thing on the climate change. There is a UNICEF study. More than 700 million children, they are at risk with the ongoing climatic conditions across the globe in different countries. So more climate related interventions we need to look in this framework. Also, I don't see any specific climate related adaptation policies for countries and contexts where we need to do more. I think one of my suggestions is to do more at country level in country clusters, especially on trainings, on such type of webinars to educate our partners, our donors, also the different stakeholders who are involved across the board in nutrition and food security and in other sectors. So yes, I think we need to do more specifically to have a more systematic approach and to promote this framework in the country clusters in our humanitarian context. Thank you.
Thank you, Shafiq.
Thank you very much, Shafiq. I see we have a wonderful piece in the chat over here. Sheila, did you want to say what you've said in the chat? Because I think it links very well with what Shafiq's just said. Can I put you on the spot there?
Yeah, definitely. It's been so great listening and seeing what everybody's doing and saying, there really is something to build on. So what I said in the chat was the expression that came to mind as you were speaking, Donatella. We say, if you're doing nothing, do something. If you're doing something, do more. And if you're doing more, do better. And I think I at least came into this thinking we're going to be in that bottom rung and we're going to be on we're doing nothing and we need to do something. But we're actually in that second ladder there, right? Of we are doing something is happening. And I think with some adjustments, with some clarity of thought around where do we want to go next with each of these, bringing things together, having the right kinds of conversations, I think we can get there. As I have the floor, I just want to say one more thing. Sometimes we get caught up in this idea of we're implementing a framework. And so we talk about, what do we do with this document? And then I think one of your comments that came through with the conversations was there's too many documents, there's too many frameworks and things. So I would encourage us to step back and say, focus on the concept of nurturing care. And think about how you can approach what you're doing with a nurturing care lens, right? So looking at your mobile clinics and saying, what am I doing here in this mobile clinic that is supporting the child's health, the child's nutrition? Is it safe and secure? Are there opportunities for the child to experience materials, interactions, objects, so supporting their learning? And is it a responsive environment where the child is feeling that their needs are being met and that they have someone they can talk to? And you can extrapolate that same idea and think about it in an immunization visit. Right. And, what's happening there? Yes, we focus on the immunization and the service there is very much health centric. But what could we be doing slightly differently to touch on those other elements there? So that in a service, whatever service it is, you're bringing in the dimensions of the 5 components of nurturing care. And then the nuance there is that, okay, mobile clinic is a bit different because you have providers that are going to provide nurturing care in that situation. But if we're talking about health workers, what the aspiration is that health worker has a depth of understanding of what that child needs. And it's very true that often we're not thinking about it for that very young child. So that's why the framework was created, right, with the spotlight. Not to say that you stop at age 3 by any means at all. This concept of nurturing care goes on for our entire life. And in fact, within WHO and UNICEF, that concept has been extended formally across the first 2 decades of life. And it is now 6 components. So the 6th one is around resilience and autonomy. But the other 5 are very much what we've been talking about here. But it is this idea of our aspiration is that the children are receiving nurturing care. And who is best placed to provide that? It's their parents, it's their family members. And so as health workers or other kinds of providers in a community, our role is not to do the work of the family. Our work is to create the conditions so that the family can do it themselves. And if we hold that thought in our minds, it helps us think about, what is it that we need to tweak in the things that we're already doing to give that power and that autonomy to the families to do that. So I'll stop there. I'm really looking forward to where this goes next. I'm here. I'm ready to help you. So I'm sure we'll have more discussions. Thanks.
Excellent. Fantastic. Thank you so much, Sheila. And I just wanted to open the floor, once again, we've, health cluster coordinators, you've all, had a chance to speak with Donatella, you've done the survey, you've had these interviews. Are there any thoughts that are coming to you right now or reflections based on having the survey results and the interview themes, presented back to you in this way? We'd be really curious to see if you have any reflections on this. All right, I'm not hearing anything at the moment, but we still have you for a little bit of time. So if a thought does come, please do, raise your hand and let us know. Donatella, I'll move to another question that we have in the chat here. And there's a comment on it. I might throw it to Aisha to ask if that's if you don't mind, but I'll read out the question first. So it's great to see all the country level activities that are aligning with the nurturing care approach. Aisha, oh, there you are. Thank you. So Aisha, since I've got you over there, I wondered if you would be happy to ask the questions that you have. Over to you, please.
Yeah, first I just want to echo the comments from others. It's really exciting to see this happening, and I'm also aware of some of the elements of nurturing care in this approach, which again I think I'm so glad that Sheila has said it first, rather than me coming from outside and saying, following the framework is not the core thing, but rather actually thinking about child development and using this approach in different ways, and that's relevant for a different context to really protect and promote child health and development. The core of my question, there's a few different components to the question, but really the core of it that I was trying to ask is how much of this of these activities, for example, there was a really lovely slide with quite impressive how many of the nurturing care framework activities are being implemented. But my question was, is it health workers that are doing it, or is it other teams? And how integrated is this with health? Because in my experience in a number of contexts, it's often not necessarily integrated and certainly not implemented by health workers. And that's where I see the biggest gap, because child development is very much a health issue, and health impacts child development, among other things. So that I think was the core of my question. And then I had some questions about measurement, but I think you answered them later on. Over.
If I can, Aisha, I cannot, of course, because I haven't figured them, so I cannot ensure the percentage of how much is of those activities implemented are more health or more nutrition or more, but because it's coming from the humanitarian response plan, which is an integrated document. So for sure, these are integrated activities. Now, I don't think I could, but maybe I don't know, maybe it is possible at a certain level really to analyze it even more. I mean, if we take one response plan and we go with the with the lens, we can find more examples. But overall, this is coming from response plan that are include all the sectors. So I didn't look only at the health. I look at all sectors that are included. So these are effort that at least partially are if I cannot say multi-sectoral, at least intersectoral. So this is how I feel like answering to this question. Of course, then country by country, we can have more information, we can have more example, but it's not, they were not only one sector activity or action.
Thank you for that. I think if it's possible, when you're working on the report, if it's possible to maybe highlight that, because I think that is kind of the core one sort of major gap in health services that, and I think probably our colleagues here in the health cluster can, better than me, can respond to in terms of challenges. But even in clinical care, it's very commonly when there's what's considered a social issue, yes, there, of course, referral is important and is part of nurturing care for sure, as you mentioned, but there's a tendency to, we can only respond to so much, therefore we outsource, or that's not our problem because it's a social problem. And so there's a failure to recognize some of the responsibilities for health workers and the main reason for that is a lack of child health expertise by health workers, which is another issue which we need to deal with separately, but this is part of it, I think. So yeah, so if you want, and I'd be happy to also speak offline if it can be helpful to give a little bit of feedback about that. But I think it's just important because I think we need to find the right way to support the health cluster coordinators and health actors. And in order to do that, we need to understand sort of what they're doing within health responses or together with other responses, and where those gaps are, and where the people who are in these places implementing responses, where they think would be most appropriate and beneficial to focus. Over.
Yeah, no, thank you.
Thank you very much. All right, that's great. So just wondering, scanning the audience now, once again, just to say that, you know, we're open, we're happy to hear reflections, observations, and also take your questions. At the same time, we have an observation in the chat. I don't know if I may put you on the spot, Kamal, to share your observation with the group.
Yeah, sure, no problem. Thank you, Andrea. Thank you, Donatella. That was a great presentation. So, basically what I was saying is that in that slide, we see that 4 out of 21 clusters or countries are saying that, you know, we have something in place. It's not, because on the other hand, what we have been observing, or what we have gathered, is that 8 countries at least have some structured sort of a guidance document to support multi-sectoral, intersectoral, collaborative initiatives. And probably there are others also who are working on it. So maybe this one is specifically focusing on those countries where nurturing care framework is part of their multi-sectoral collaboration. So that was just my question. But having said that, what I think is that, you know, out of those 8 or 10 countries, whatsoever be the case, how many of them have the guidance in the drawer? How many of them are actually implementing them? Is good for us to ruminate on about. So yeah, that's another thing. So yeah, that was just the observation from my side. Thank you.
Yeah, no, I don't have a real answer. I have another comment on your comment. I think, Kamal, we have discussed already a couple of times. Yes, in this case was relative, the intersectoral collaboration was relative to the nurturing care approach. And I'm sure, and I know because I've been saying, and this was our discussion maybe a couple of days ago, how do we use the intercluster coordination structure and mechanisms to, you know, further implement or develop this approach. There are, as we say, there is a lot of going on. I like one of the quotes, but there was another thing that struck me during the interview. Someone said, "We do it, but passively, not actively." So it's somehow this, if you want, it's we do it, but we don't do as, you know, the nurturing framework or care in our mind. We do it because they are part of our vulnerable population, and of course we assist a lot of these kids. And we don't only look at their health, but also many times, not as many as we want, in an integrated manner. Now, I think to move from a passive implementation somehow, or a passive integration to an active integration, I think there is a lot of road ahead. We have some idea how to do it. This was, I don't know if Andrea, you agree, but maybe there is, we are already tired and we can do it later. In the slide of the work plan, how do we move from not really agreeing that the integration is happening to, agree that, we are moving forward and we all agree that steps, that integration is happening. Maybe we can show that slide and see if anybody has other idea of activity that we can put in our work plan that would be, important to enhance this implementation or integration, because, maybe there are other ideas. Maybe there is work that for sure, Kamal, you have done. There is work that has been done on localization. There is a lot of work done on early childhood in the early childhood platforms that can be used. We don't need to reinvent the wheel. So I don't know, but we need to do more. There is no doubt, and I'm happy again to say that yes, again there is. We are doing some. We should do more, and how do we move forward is really somehow the key, and not being happy. Yes, we already doing some. I think it's a good picture what we have found at the, with our with this baseline assessment. But how do we move forward with, I think, limited resources, overall limited resources? And these, although, yes, it's not the first complaint, but it is repeated multiple times that we lack resources to be able to, to move forward, to give the importance that need to be dedicated to this subject.
Thank you very much. We do have another comment in the chat that is linked to the section of your presentation in which you spoke about community engagement and the role of community health worker. So I wondered if we could throw this open to the participants and group over here. The question, the comment is, as much as we want to do everything in an emergency, the reality is that one health worker is doing almost everything in the affected area. In vulnerable areas with little or no incentive. So there's a need for an operational perspective, and there is a need to know what is the minimum required or scenario-based package. So this is around, a health worker, doing multiple tasks, and how do you operationalize this nurturing care framework approach? I wondered if I could throw that open to some of our health cluster coordinators over here in attendance to see what your thoughts are on that. Through the partners that you work with, what is the role? Is the health worker being overloaded, and how do we make sure that this integration can take place more seamlessly through an operational perspective? Does anyone have any thoughts or examples or reflections they would like to share?
Andrea, I have one small parenthesis in the sense that there are countries where we train and we work with hundreds of thousands community health workers, 200,000, 300,000 people. These are big number and huge opportunity. I close it.
Yeah, sorry. My mistake over there when this is in relation to the health worker. So not just so it could be a community health worker, it could be a nurse, a midwife. So it could be any level of health worker. But yes, anyone wants to come in on this? So please, Sheila, please do go ahead. Thank you.
Like you, I really want to hear what the health cluster coordinators have to say on this. And I'm thinking in my mind saying, you know, what could we be proposing? What could we be doing? And I think it is going to vary context to context. But I think one of the very small, simple things, like if I think about a minimum, is that are you connected up with other services that are happening around you? Do you know where to send a child that is malnourished? Do you know that there's a mobile clinic happening in your area that you can encourage a family to take part in that? So for me, it's not so much at a minimum, not necessarily about telling a health worker who already has a lot to do more, but for a health worker to be informed about what else is available and who else could help a family that might need help, and ensuring that that family is aware of those services and providing information about how to utilize those services. That would be at a minimum. There are other things I can think about that, okay, in a service, in that interaction that the health worker is having with the family in front of them, what are some small subtle things that we could do? But those I think will take time to think through, and also, yeah, would be more context specific, I think.
Thank you very much for that, Sheila. Is there anyone who'd like to follow on with that?
Maybe
Yes, please, Shafiq.
yeah, so maybe three important areas. First, for caregivers, no, sorry, for the health workers, to their engagement and their interaction with the caregivers, especially for three specific areas. For nutrition, their role is very important. So we need to educate them on the importance of how to interact effectively with the caregivers or with the parents. For example, for nutrition, for breastfeeding, the importance of breastfeeding, for balanced diets and appropriate complementary feeding interventions. Also for hygiene and sanitation. Also, this is also important area to engage with, specifically in our call response with the parents, with the family members and caregivers on hygiene practices, safe hygiene practices, also on the prevention of infection and environmental and in household related hygiene practices. Another important is for immunization. So in the immunization teams, we have the social mobilization teams. They are closely work with the immunization team. I think this is another, beside the community health workers, this is another important let's say stakeholders are important change agent in terms of engaging with the caregivers. They are part of the health response. So those community social mobilization teams who are working with immunization team, they can play also an important role in promoting vaccination for children for different diseases. So I think these three areas are more critical, and we can do a lot in these three specific areas beside other health interventions.
Thank you very much for sharing those three areas, and I see that it's gathering a little bit of momentum in terms of this discussion in the chat. So thank you for that. I do encourage you to take a look at whatever the audience is posting in the chat. So that's great. Thank you very much. We do have another area on resources. So there's a question on, a comment on exploring, resources and resource availability. And then another comment about the resource question being very important, and followed on by James. Actually, may I put you on the spot? You'll say this better than I will. May I put you on the spot to share your comment with the group?
Thanks, Andrea.
Thanks.
Apologies, I was in at the beginning and then I had to step away, and really glad to join at the end. I think there's, and lots of examples are being given. There is low-hanging fruit around sort of health promotion, I would call it, in terms of what is in scope of the urgent care framework, and indeed that brilliant slide that Donatella presented. The bar that was the lowest was, of course, sort of the milestone monitoring, and I think as when we presented in the webinar, that was described, and I'm going to specifically call out the Syrian colleagues that really said, I resisted it for all the reasons that have just been described, too much resources, health workers are overworked. And then we did it, and we were all sort of changed our realization to be better healthcare workers and better parents. And so I think it's important to zoom in a little bit on that, to describe when that engagement on interaction play therapy during inpatient care, does that get, we need more evidence still on, does that give better outcomes? Then it's not a resource question anymore. It's an effectiveness question. So if we're not convinced, then we indeed need to do more research. If engaging with parents that perhaps are facing postpartum depression or other strains in their families, which we know are numerous, it's not for the health worker to deal with all that, but where they can help to better network. Does that prevent future childhood illness? That reduces workload, doesn't increase it. So it's a question of whether we need more evidence to convince people to maybe consider exactly when it should be prioritized and when it maybe is more than the system can do at a particular moment. Thanks for the opportunity.
Brilliant. Thank you very much, James. And we have another comment in the chat. Thank you for that. Saying this goes back to child health expertise among child health workers tasked with providing care for children, and perhaps this is the lowest hanging fruit in a response to improve. Donatella, I wondered if you wanted to, just go over, you had mentioned during your presentation that, resources or funding were maybe not the first barrier that you came across when you were speaking to the health cluster coordinators. I wondered if you wanted to revisit that point really briefly. Over to you, Donatella.
First, if you allow me 1 minute for James' comment. I cannot agree more, James, on the fact that, monitoring what we do will not only say better what we do, but will then become part of our activity that will also reduce, our work. Because if we take care of this child in a more holistic way, then this child will have less opportunity to come back with other disease or with developmental issue. We have discussed also a lot about, how do we measure our intersectoral activity or our multi-sectoral activity. It's evidence to all of us that this is at least, more efficient. But it's very difficult with the tools we have to monitor and to demonstrate. And it is also, and it will be a challenge also to develop an integrated framework on a framework to monitor the framework approach, because it's already difficult to capture the indicators for, I don't want to say more basic activity, but primary healthcare activity, and these are more complex. Complexity doesn't have to stop us, but having limited resources, having also partners scattered all over, busy with a lot of priority, and it's gonna be hard. And but this doesn't mean that we don't have to do. We do have to do. Sorry, parentheses. For the resources, I was just pleased that it was not the first, okay, we need this. This is somehow it's used in many interviews, in many conversations as an excuse. We don't have resources, we don't have money, we can do nothing. That was not the approach. This doesn't mean that basically all of us, all of you guys that participated in the interview didn't raise the question. Resources, and I didn't present, I initially want to do a slide on donor, on funding, and it's like the one on capacity building and training. It was a pie that I couldn't present. It was all no. So there are few donors. And again, I think there is sensitivity. I don't know if I can say there are open door and venue, but we are not, using them enough. We don't have tools, we don't have language, we don't have material, and we have other priorities. So I think it's somehow up to, and when I say, competing priorities, also when I say competing approaches, the cluster coordinator are confronted with a lot of approaches, a lot of theories, a lot of activity that they need to put in place, and it's difficult to give priority when you don't have, a dedicated resource. So the answer is not always put a new person, add a new person, add the new cluster coordinator with a focal. No, I don't think they are advocating for that. But of course, this is needed. There is needed for funding. There is needed for more resources, financial resources, but also human resources dedicated to issues to continue this conversation. And as we say, to moving from I hardly agree to really agree that step have been made to further integrate this approach in what we are doing.
Thank you very much. We're almost at time, so you've been with us for an hour and a half. I really appreciate that. Donatella, thank you so much for taking us through this presentation and the piece of work, and very much so to the health cluster coordinators who have taken the time to do this survey as well as the interviews. Your engagement is truly invaluable and will really help us to try and shape what we need to do next. And for everyone else who was in attendance, your comments, your participation, and all of your words are really taken to heart over here, and we thank you for your time. Have a wonderful rest of the day wherever you are.
Thank you.
Thank you so much.
Thank
Have a great day.
Bye.
Thank you.
Thanks.